You've had a knee replacement, or perhaps you've had a hip replacement. One of the concerns we have after surgery is blood clots. These are known as DVT, or deep vein thromboses. DVTs were traditionally prevented with the use of medicines or injectable blood thinners. Those are referred to as Coumadin or Lovenox. However, some of the problems with these thinners has to do with hematomas and excessive bleeding after surgery. As a result, we've been exploring new options for treatment, such as a mechanical foot pump and aspirin. The aspirin thins the blood slightly, while the foot pump acts to pump the blood back to the heart during the time that you are immobilized. A recent major study in the Journal of Bone and Joint Surgery showed superior outcomes with the use of aspirin and mechanical foot pumps when compared to traditional blood thinners. Not all persons are ideal candidates for aspirin and pumps. Some persons who've had blood clots in the past or have sticky blood, or who are obese, have had strokes, cancer, or selected comorbidities may be better served by having traditional blood thinners. Those persons already on blood thinners for atrial fibrillation or a history of previous blood clots are also best served by maintaining traditional chemoprophylaxis. A member of our medical staff will speak with you and review your medical chart to determine if you are an ideal candidate.
My name is Tim Leahy, and with Carepoint, we service this pump for DVT prophylaxis. The reason you're wearing this pump is there is a period of inactivity following your total joint replacement. That inactivity of muscle action, which normally keeps blood flow going in the deep veins of the lower leg, this pump takes over for that lack of muscle action by gently massaging that muscle to keep blood flow going. You'll need to wear this at least 18 to 20 hours a day for it to be effective. Included in your pump kit, which will be delivered to your house, is the box, the pump and case, the sleeves, the AC charging adapter, non-slip socks, and protectors. Place the protective sleeves over the skin on both legs. The pump is placed over the head and on the opposite shoulder. The sleeves are oriented in the proper position with the tube and the inside of the leg and the tube inlet closest to the ground. The sleeves are placed from the inside, not the outside of the leg. They're wrapped around as tightly as possible. It's very important that you ambulate and walk around as much as possible. The best prevention in blood clots is mobility. So the more you're walking around in conjunction with wearing this pump, the more you'll be protected. To eliminate the trip hazard, please wear the clip. It can be affixed to your garment. To turn the pump on, push this button here. The mode button, you want to make sure it's on double leg. If it's not, push the mode button until it's on double leg. The pump begins pumping. It alternates sides. Troubleshooting. If the pump is only pumping on one leg, check the mode button. As you can see, it's set up on the blue light for single leg. You need to change it to double leg by pushing on the mode button, and it'll switch to double leg. It's a good idea when you're sitting around watching a movie or reading a book to keep the charger plugged in. To plug the charger in, simply push it into the bottom port and the green light goes on indicating it's charging. A Carepoint brochure will be provided to you which describes the use and return of the pump as well as contact information.